There's been a rise of wearables among people, but are people actually sharing this information with their doctors, which I would think you would want to know?
I would want to know, but the problem is the healthcare infrastructure is not set up for us to receive this information as physicians. So it's been really interesting. Even in my career, we started out with the information going from me to you, from the doctor to the patient, right? That was always how people got information. Now it's become more bi-directional, where people come into my office and say, I saw this on social media, or this is what my wearable found. What should I do with it? I wish there was a systematic way for them to bring us that information, because we're now seeing that 40% of American adults are using wearables to track heart rate, to track sleep. I don't know if you're one of them, if you have
not. Should I?
Okay. Well, let's talk about it.
Okay, that was my follow-up question.
Yeah.
Should you would you tell your patients to wear a wearable?
I do, but I tell them to have some caveats when they wear it. So when people do wear a wearable, you have to do something with that information. You can't just use that information and not do anything with it. So bring it to your doctor. But we actually have guidelines now that tell us what we should tell our patients about wearables. First thing I tell them, it is a screening tool, not a diagnostic modality. Meaning if the wearable says, like the Apple Watch or the Fitbit are the two that are FDA cleared, says you have an arrhythmia. One called AFib is the one that it looks for. You know that very well with your personal family and dad. But it essentially screens for AFib. Then I, as a cardiologist, need to use a diagnostic tool to actually diagnose it. Now, the nice thing is the wearable has pretty high accuracy when it comes to finding AFib, 80 to 98% accuracy. Wow. So that's really good. But the second thing I tell them is take it with a grain of salt. So you get false positives, which cause unnecessary worry, anxiety, workups, and you get false negatives. So I have patients who are having chest discomfort. They'll snap an EKG on their watch and then not go to the emergency room because this one lead EKG suggests that nothing is going on, and that's not a good idea. So where I find wearables most effective, even for myself, is behavioral change. When my watch dings me and says, you haven't moved, or you haven't hit your exercise goal today, that's when I think they can be really effective.
Okay, so those are good reminders. What types of diseases are wearables most promising for, would you say?
So the evidence tells us arrhythmia screening is one of the best, because the wearables are really good at looking at whether your heart rate is regular or irregular. Now, we don't know if the irregular is AFib or the irregular is PVCs or a different type of arrhythmia, but it's a really good sort of normal, not normal screen.
And call your doctor if it's not normal, right?
That's exactly right, because then I'm going to put a heart monitor on you that you're going to wear that's going to check your heartbeat for 2 weeks, and we'll see if it's actually real or not. So really good for arrhythmia detection. We're trying to dabble in chronic disease management. So could there be wearables that could, you wear a patch and it tells you about your blood sugar, a patch that tells you your blood pressure all day long, using something called photoplethysmography, sends in little light waves to see what your blood pressure is. These are all things we're sort of starting to dabble in. The data right now is mixed, so we don't yet know, does it change disease outcomes? Because the idea is not just to get the information, but to actually make somebody live longer, have fewer heart attacks, have fewer strokes. We don't know that yet. Sleep is huge, right? Phil is obsessed with tracking his sleep.
He's like 5-hour deficit.
So what happened with me, and this is why I say about kind of the double-edged sword, is I started wearing a watch that tracked my sleep, a ring, an Oura ring. I would wake up in the morning and it would say you slept poorly. So then, of course, I felt poorly for the rest of the day. So there are some people in whom it doesn't necessarily help, but it hurts. But it's a really exciting frontier. And then with all the heat wave coming, monitoring body temperature, looking for heat-related illness, heat-related stroke, or heat exhaustion, that is a really promising field as well.
Okay, Dr. Coley, great information as always.